Hey everybody, Dr. Misty from New Horizon Chiropractic and Wellness here. How are you? So we're going to talk about scoliosis one more time. This time, instead of telling you some details about what exactly it is and what causes it, that's in the first video, I'm going to talk about how you can manage it and when it typically shows up. So I mentioned a little bit in my last video that scoliosis is typically adolescent onset. So you're going to see it most likely if it's an adolescent onset scoliosis. There's a few different types of scoliosis. If it is a true scoliosis, you're going to see it start happening during the puberty years. Some kids, you can see it earlier than that, but typically you're going to start seeing it develop more as the children are going through a developmental phase. Sometimes there is adult onset scoliosis. It's more rare. Typically it's following some sort of either injury, say if you have osteoporosis, which is low bone density, you have a fracture of the spine that can cause and lead to a structural scoliosis. And so when I'm saying structural, it means the actual structure of your spine. It's not functional, which is changeable. Functional means that when you have a functional scoliosis, it means that it's caused by some sort of biomechanical dysfunction or spasming of a muscle, something that can be changed. A structural scoliosis cannot be changed. So if I said you had an adolescent onset scoliosis, structural scoliosis, that means unfortunately that's the way that your spine is made up. And again, what that means is that there is a lateral curvature to a spine. So thinking lateral meaning sideways curvature to the spine. Okay. So that's a very important thing to get your children examined for. Typically they do a test. Nurses come to schools and they do tests for screening tests for that. Sometimes it's mild. Now treatment wise, if it is an adolescent onset scoliosis, it's going to be managed more by what's called a watch and wait type of approach. So there should be some form of x-ray. Say you do a screening process and there's some hesitation in saying, okay, well, there might be a scoliosis here, let's check this out. You're typically going to want to get an x-ray to look further into that. Once you get the x-ray, you can determine if there is a scoliosis and what the degree of curvature is. And what happens from there is, depending on what the degree of curvature is and where the curvature is going to depend on what the treatment is from there. So if you're a child and say you have a scoliosis in your mid-back and you have a larger degree of curvature, that's going to require, sometimes it requires what's called bracing. Bracing is a technique where as the child grows, they're in sort of a tight brace to minimize the curvature throughout the day. It's worn under their clothes. That can be an effective treatment for scoliosis to make sure that it doesn't get too severe, because let's remember that our spine is our structural system. It has many different purposes. One of them is to actually protect our internal organs. And so if we think of in the mid-back, in the chest, what's inside is our heart and our lungs. So if there's a really bad scoliosis, we want to make sure that that gets managed, because it can have effects on a child's lung capacity and heart and give you problems there. So it can be in some cases more severe. Most cases it's going to be a little bit more moderate to on the mild side. There are people that go throughout their lives that don't even know they have a scoliosis, which means it's very mild. If it's in the low back, which is the lumbar spine, it's less severe. It's more of an aesthetical type of thing and a pain management type of situation. Now let's not forget that our spine is basically our home for our main electrical system, right? Our spinal cord and our spinal nerves. So scoliosis can affect the nervous system as well as, the spinal tissues. So what happens is, and we're going to come see Mr. Spiney again here. Excuse me. Okay, so going back to the spine and it being the home of the electrical system. So looking here, there's from the back, these are the joints of the spine, so where the bones come together. Okay, so what happens when you have that sideways curvature is that, you know, think about one side of the spine has more pressure on the joints than the other side. One side of the spine has more shortened ligaments, which are like really taut elastic bands that keep the bones together and tight. One side of the ligaments is going to be a little bit longer than the other and taut. One side of the spine is going to have muscles that are consistently tightening and trying to stabilize the spine. That should normally be straight, right? So the tissues surrounding it should be compromised. What you need to do if you do have more of a scoliosis that's, again, structural or functional, okay, that's not really a large degree. It's more about pain management, okay, and quality of life, preventing further injuries, arthritis, disc bulging, neuropathies, pain going down your arms and legs, numbness and tingling. Okay, those are all things that you'd want to look for that can be linked to scoliosis. That would certainly not the only thing, but one thing you can do to manage it is move. I can't express that enough. Scoliosis, you need to be moving, exercising in order to keep management on the pain. Great exercises to do are swimming, takes pressure off the joints. It's probably gonna feel better. Yoga is wonderful, keeping that flexibility of the spine. Is also doing exercises that stabilize the spine. So if you're familiar with these exercises, you go to the gym, oblique exercises. So the ones where you're twisting, spinal twists, planks, side planks, things that really work on that side to side movement and that those deep abdominal muscles. Okay, that's going to be your core stability. That's so going back to the gym, yoga, core stabilization exercises, Pilates is great for that. If you don't know a lot of these exercises, going to a Pilates class is going to engage a lot of that. Physical therapy is going to touch on a lot of this. All these are great. All these are great things to do. Chiropractic is going to help with the mobilization of the joint. Again, movement is key, right? So you're doing active movement by yourself, you're doing the gym, but you can be more prone to joint fixation, right? Because your joints are naturally at a different angle and there's more pressure. So chiropractic is really great at recreating some of that movement, taking some of the pressure off the spine. Great pain relief, great for nerve relief, for entrapment, and releasing the muscle tissue. Very good and effective pain relief treatment for scoliosis patients. So those are just a few things that you can do in order to manage the condition. Obviously, there's multiple ways to manage it, depending on your case and depending on how severe it is. So again, I'm Dr. Misty Kosciuszko, New Horizon Chiropractic and Wellness, and I'll hope to see you soon for more information. Thanks for watching.